Everyone wakes up to the same sun, but many wake up to different possibilities. Each year, 100 million people are pushed to poverty because of ill health, especially in countries where people need to pay directly to healthcare providers. This is termed out-of-pocket expenditure. When households spend a substantial part of their income on health, the results are catastrophic. The World Health Organization estimates that about 150 million people around the world face catastrophic health expenditure every year.
Ayokong mamatay na mahirap.
Kung wala kang pera, Diyos ko, anong gagawin mo? Mamatay na lang yung tao doon.
Pag hindi po namin nabayaran yun, yung bahay at lupa niya, mahihilip.
In countries with high out-of-pocket health expenditure, health costs push many entire families into poverty, all because one member got sick. In many instances, high out-of-pocket expenditure is a result of low government spending on health. But in countries with universal health coverage, the risk of catastrophic health expenditure and the resulting impoverishment is low. Now, many governments are increasing their commitment to universal coverage.
A commitment to universal coverage means, in practical terms, ladies and gentlemen, that all people within a country should receive some degree of financial protection from the cost of at least some basic health services. This means, in ethical terms, that no one in need of health care, whether curative or preventive, should risk financial ruins as a result of paying for this care.
The World Health Report 2010 suggests 3 strategies to attain universal coverage. They are: raise sufficient funds for health through prepayment financing mechanisms, reduce heavy reliance on out-of-pocket payment, and improve efficiency and cut waste. To get closer to universal coverage, the country would need to extend coverage to more people, offer more and quality health services, and pay a greater part of health care costs. Countries in the Asia-Pacific region adopted region-specific health financing strategies to support universal coverage.
Mongolia is a very specific country because it's the large land and small population. Our health financing system is mixed with budget and social health insurance. It means in all Mongolian citizens can access free of charge for primary health care system.
Like Mongolia, many countries in the region mobilize funds through taxation to provide primary health care and coverage.
China is just pushed forward a new rural cooperative medical scheme. Nowadays, it's already the coverage rate, it already reached about 19% of the whole China rural population.
China has achieved a breakthrough in its basic health insurance program by increasing central and local government subsidies to rural populations. Along with coverage, ensuring access to quality health care is an important policy objective. Cambodia's Health Equity Fund is designed to strengthen the safety net for the poor by paying for their health care and providing transportation and food subsidies.
Health Equity Fund is the pro-health financing strategies. The main objective of the equity funds is to reduce the financial barriers access to the health services, in particular by the poor. The equity fund has covered around 70% of the people who are living under the national poverty line.
Health insurance is another prepayment financing option to raise additional funds and reduce out-of-pocket payments by pooling both risks and funds.
When people are sick and when they are seeking care and they have to pay for health care, so they might be put into insecure situation because they are facing double burdens. They are losing health and losing money. Insurance, can pay for healthcare costs.
Community-based health insurance supplements healthcare coverage and helps to reduce financial barriers.
Community-based health insurance in Laos is organized currently in 23 districts. with 11 districts is out of that is rural district.
เพราะว่าเพิ่นได้ช่วยเหลือเฮาเบิ่งแยงเฮามาย่ำใดเพิ่นก็เบิ่งต้อนรับเฮาดี
Efficient use of scarce resources is equally as important as raising funds for health. WHO estimates that between 20 and 40% of all health spending is wasted through inefficiencies. Those inefficiencies include irrational use of medicine, overuse of diagnostic services and medical equipment, and inappropriate hospital admission and length of stay. Irrational use of medicine is also a problem. In some countries, medicine accounts for 65% of hospital expenditure or 40% of total health expenditure. These are examples of ways to reduce inefficiencies, to get more money for health and more health for the money. Universal health coverage cannot be achieved in isolation since health is linked with other social determinants such as education and income.
The Conditional Cash Transfer Program, or the Pantawid Pamilya, is implemented by giving conditional cash grants to the poor provided that they follow the conditions on health and education. By investing on health and education, the program aims to improve the quality of life of beneficiaries.
At least 85% yung attendance ng bata sa school, tapos may monthly na check-up sa health center. So yung kagandaan lang, mauobliga yung mga parents.
Universal coverage is an admirable goal, and homegrown health financing policies and actions make the difference. In fact, no country starts from scratch when it comes to financing health care. All have some form of system in place and must build on it according to their values, constraints, and opportunities. Devising and implementing health financing policy is a process of continuous adaptation. Health financing must adapt, not just because there is always room for improvement, but also because society is in constant evolution.
Universal healthcare coverage is vital for a country's economic growth, vital for a country's security, and vital for a country's social solidarity.
There is no magic pill to achieve universal coverage, but once governments are committed, countries can raise sufficient funds for health, move away from out-of-pocket payment, and build more efficient and equitable health financing systems that support universal coverage. Then, people will realize that universal coverage is not just a dream, it is a realistic goal. Each new day offers new hope. With universal health coverage, people can wake up to a better day, healthier, productive, and financially secure.